Caitlin Maloney, 17, woman on campus.
Hey everyone, it's Caitlin. With so many majors to choose from, I want to make your major decision as easy as possible. So today, I'll be highlighting one of our most interdisciplinary programs, public health.
Donna Cold, assistant professor. 2 young women look a laptop in a classroom. 2 women wear white coats in a lab. 2 women stand next to a poster with the header, examining the impact of homelessness on women with children.
I really enjoy teaching Simmons students because they come here with an intellectual curiosity about issues concerned with equity and social justice.
Students sit and talk in a classroom. A woman takes notes. 2 women type on laptops in a classroom. A gloved hand pipettes clear liquid from a jar.
Our nationally recognized undergraduate public health program was one of the first in the country. It's divided into 2 unique tracks, the biology track and the social analysis track.
A woman talks in a classroom. 2 women stand and talk in front of a poster with the header, Small World Initiative at Simmons, the implementation of a crowdsourcing research lab with a focus on antibiotic discovery.
This innovative structure allows students to focus on one area of study while gaining a holistic view of the field.
3 women talk in a group setting. An instructor points to text on a whiteboard. Professor Valerie Leader, co-director, Public Health.
Everybody takes the same core classes, but then you take 3 classes that are special to your track and then a couple of different electives. They can take a range of different things: organizing for social justice, health psychology, biomedical ethics.
Students work in groups in a classroom. An instructor stands and talks in front of a class. 3 young women work in a group. Sign, S235, Biology Laboratory. Penweeb, 17, Public Health.
I am on a biology track. I am especially interested in microbiology about infectious disease.
Students in the lab pipette liquid into small tubes. 3 students write on a whiteboard. Jillian Weaver, 19, Public Health.
I'm on the social analysis track. Right now I'm really interested in environmental health and how it relates to community-based disease.
An entrance sign reads, Fenway, Muddy River Reservation. A man buys produce at a farmer's market. A sign reads, Brigham and Women's, 221 Longwood Avenue.
At Simmons, our undergraduate students pursue research opportunities both on and off campus. Many students work as research assistants for our public health professors or at medical institutions in the renowned Longwood area.
Sign, Boston Children's Hospital, until every child is well.
My research focuses on HIV/AIDS among African American women.
A young woman writes on a whiteboard.
I'm also working with students on criminal justice reform and mental health.
My lab is an applied microbiology lab.
Elizabeth Scott, co-director, Public Health. 2 students wear white lab coats and pipette liquids into tubes. Gina Chimento, 17, Public Health.
And currently I have 7 undergraduate students working with me.
I do research on Staphylococcus aureus, which is a bacteria that's a really big problem in hospitals. Gaining qualitative and quantitative research skills is really beneficial in trying to find a job.
Gina types on a laptop in the lab. The heading on a blackboard reads, Staff Identification Process. A student places samples in a centrifuge. Hoden Muss, 18, Public Health. Hoden talks to a group of people.
I've been in Professor Elizabeth Scott's research laboratory. I get to culture bacteria, do different tests on them, and it's a really great way to not only build your skill, but to also be confident in working in a lab.
An engraved sign in marble reads, Harvard Medical School. A student reads a document.
I work study at Harvard Med where I get to do genotyping. It's exciting. I've read about it in different articles in my biology classes here, but I didn't think I'd actually be doing it and seeing how it really works.
All our seniors are required to do a capstone experience, and usually that is an internship. There are all kinds of opportunities.
I interned twice at Fenway Health, which was wonderful in preparing me for then taking on a position as an employee with them. I work specifically in the research department doing HIV prevention and treatment. There are lots of public health problems.
An instructor speaks in front of a class.
There's a lot of need for professionals in the field. People can do lots of different things with this degree.
Morgan Ward, 16, fellow, Boston Healthcare for the Homeless Program.
I'm doing a fellowship with the Boston Healthcare for the Homeless Program.
Morgan wears a graduation outfit and stands with a faculty member.
Being a case manager, I'm able to advocate for a patient.
Pedestrians walk across a street. An ambulance drives by.
I'm sort of like the first point of contact when it comes to patients wanting to engage in care with us.
I want to go to graduate school and eventually get a master's in public health, either in epidemiology or social epidemiology.
Everything I learn here, I can take it back to the country I was born in, Burma, and I want to use these skills to improve the health
of the country one day.
If you'd like more information on our undergraduate public health program or our master's in public health, head on over to simmons.edu and search public health, or tweet at me @WomenOnCampus. I hope you've enjoyed this video, and until next time, have a great week.
Text your moment, your move, your Simmons, where leaders make themselves. Woman on Campus, Public Health Department, @Woman on Campus, Caitlin Maloney, 17.